Good afternoon. Lee Harris, Mayor of Shelby County. I'm pleased to be here on behalf of the Joint COVID Task Force. Right now, we are in a very challenging period. We know we are in the fall surge. There is some good news on the horizon. Vaccines have been identified and the results so far look promising, but we are still several weeks away from even a limited distribution of any kind of vaccine in Shelby County, and probably months away from a vaccine that's available to all. And so until then, we have to all work to continue the course. That's why this week we will be working with the leaders across West Tennessee and throughout our region to encourage masking. That includes to encourage those other communities to adopt mandatory masking requirements. And so the health department and other stakeholders and yours truly will be meeting with those leaders this week. There are some 21 counties across West Tennessee, and there are 70 cities across West Tennessee. And so we will try as best we can to encourage all who can to adopt a mandatory masking approach, because that will help everyone in our region. We know that what takes place in Shelby County affects the outlying communities around Shelby County, and what happens in those communities affects Shelby County. The virus has no boundaries, and so we have to continue to work together from a regional perspective in order to slow the spread. Also, we're going to continue to encourage all organizations in Shelby County to adopt screening techniques, which, by the way, are required under the Shelby County Health Directive. One of the things that we've learned so far is that even a small number of cases can lead to spread and an outsized number of confirmed cases. In Shelby County, we've adopted digital screening as our approach after a few trials and error. This process is incorporated right now in at least 6 of our buildings, and we are constantly expanding and reviewing our digital screening approach. For the month of October, we screened more than 14,000 people that entered into Shelby County government buildings. And since our digital screening process began in August, we have screened over 31,000 individuals. About 80% of the folks that experience our digital screening process are able to give us their background as to signs and symptoms using their iPhone, and then the rest are able to use an iPad that is set up, an iPad kiosk that's set up outside many of our interest locations. The technology used for our screening process is technology that we have, for the most part, developed internally, including the web forms and the QR codes and so forth. And so just kudos to the Shelby County Information Technology Services and our Office of Performance and Innovation. One of the benefits of the digital screening is that we have been able to redirect people that do present signs and symptoms. Through the screening process, we've redirected about 106 individuals so far. In addition to that, the digital technology allows us to have more social distance between screeners and identifying the information that's needed. Contact tracing is also a lot easier with the digital screening because it makes it easier to have in one place the identity and the contact information for everyone who visits our buildings. So we continue to work on this process, and we continue to encourage all organizations to adopt some kind of screening protocol per what you'll find in the health directive. We know that none of these tools are foolproof, and the virus is highly transmissible, but this is one of the tools in the toolkit that'll help us to identify those folks that could lead to, as I said, outside spread. If you want technical assistance on setting up your screening at your organization, we'd be happy to assist, and we'll put up a slide with a contact phone number. Please reach out to us if you would like technical guidance on setting up a screening protocol at your organization. At this time, I'd like to welcome to the podium David Sweat, who leads the COVID response.